Scientology, founded by L. Ron Hubbard, presents itself as a religion. However, its practices, particularly regarding health and medicine, raise serious concerns. Hubbard, a science fiction writer, not a doctor, developed doctrines that directly contradict established medical knowledge. This has led to Scientologists suffering needlessly, their well-being sacrificed for Hubbard's questionable teachings. One of the most alarming aspects of Scientology is its rejection of most conventional medicine and well-proven therapies. Hubbard denounced psychiatry and psychology, labeling them as barbaric and harmful. He instilled a deep mistrust of these fields within Scientology. This has tragic consequences, preventing individuals from seeking necessary mental health care. Instead of evidence-based medicine, Scientology promotes its own practices, often ineffective and potentially dangerous. Auditing, a form of counseling unique to Scientology, claims to address spiritual and psychological issues. However, its methods lack scientific backing and can be emotionally distressing. Scientologists are strongly discouraged from seeking conventional medical treatment for mental health concerns. They are told that such treatment will hinder their spiritual progress and may even be used against them. This creates a dangerous environment where individuals may suffer in silence, denied the help they desperately need. The consequences of Scientology's rejection of most conventional medicine are far-reaching and devastating. Numerous cases illustrate the human cost of these beliefs. Former Scientologists have come forward with harrowing stories of physical and mental suffering endured due to the Church's stance on medical care. One such case involves Lisa McPherson, a Scientologist who died in 1995 while under the care of the Church. McPherson, suffering a mental breakdown, was taken to a Scientology-run hotel instead of a hospital. She was denied proper medical attention and tragically died after weeks of confinement. Another disturbing case is that of Jeremy Perkins, a young Scientologist who, on March 13, 2003, at the age of 28, stabbed his 54-year-old mother, Ellie, also a Scientologist, 77 times, allegedly in an attempt to remove her evil eyes. Perkins, discouraged from seeking professional help, was subjected to Scientology's practices, which proved ineffective in addressing his deteriorating mental state. These tragic stories highlight the dangers of Scientology's medical policies. By discouraging conventional treatment and promoting its own unproven methods, Scientology puts its members at risk. The Church's disregard for evidence-based medicine has resulted in preventable suffering and loss of life. The experiences of former members like McPherson and Perkins serve as a stark warning. Scientology's rejection of conventional medicine is not a harmless eccentricity. It is a dangerous doctrine with potentially fatal consequences. L. Ron Hubbard's influence on Scientology extended to personal habits, including smoking. Despite the overwhelming scientific evidence linking smoking to cancer and other health problems, Hubbard was a heavy smoker. He even went so far as to make questionable claims about the supposed benefits of smoking. In his lectures and writings, Hubbard downplayed the risks of smoking, even suggesting that it could enhance mental clarity. He reportedly claimed that nicotine helped clear the mind and improve focus. These assertions, completely at odds with scientific consensus, had a profound impact on his followers. Hubbard's endorsement of smoking created a culture of acceptance within Scientology. Many high-ranking members, following their leader's example, were also heavy smokers. This normalization of a deadly habit within the organization raises serious concerns about the judgment and ethics of its leadership. The fact that Hubbard, a self-proclaimed expert on the human mind, would promote a habit so demonstrably harmful to health is deeply troubling. This contradiction further underscores the dangers of blindly following Scientology's teachings without critical examination. The legacy of Hubbard's smoking habit is evident in the prevalence of smoking among Scientologists. While the Church denies any official stance on smoking, anecdotal evidence and observations suggest a higher rate of smoking among its members compared to the general population. Former Scientologists have reported a pervasive smoking culture within the organization. They describe a permissive attitude towards smoking, with many members, including high-ranking officials, engaging in the habit. This acceptance of smoking stands in stark contrast to the growing societal awareness of its dangers. The lack of an official anti-smoking policy within Scientology, coupled with Hubbard's own history, sends a dangerous message. It normalizes a deadly habit and potentially discourages members from seeking help to quit. This silence on such a critical health issue is irresponsible and puts followers at risk. The Church's inaction on smoking further demonstrates its disregard for the well-being of its members. By failing to address this issue, Scientology perpetuates a harmful behavior and contributes to the suffering of its followers. Hubbard's teachings against conventional medicine and psychiatric therapy, along with his encouragement of smoking, have put generations at risk. The consequences of these practices extend far beyond the immediate health risks. Long-term exposure to smoking increases the likelihood of chronic diseases such as lung cancer, heart disease, and respiratory conditions. These ailments not only affect the individual, but also place a heavy burden on families and communities. The Church's stance has led to tragic outcomes for many, with former members recounting stories of loved ones lost to preventable diseases. The psychological toll of discouraging psychiatric therapy can lead to untreated mental health conditions, exacerbating the suffering of members. The failure to provide much-needed medical care to its members is equivalent to abuse. By ignoring established medical practices and promoting harmful habits, Scientology has created a legacy of pain and loss that spans generations. If you found this video informative, please like, comment, and subscribe for more content. Your support helps us continue to shed light on these critical issues. Thank you for watching.